today you're going to talk to us about one of your studies, and then if you can talk to us about that in terms of how advanced practice nurses can use biostatistics to influence their professional practice and patient outcomes.
Yeah, for me, I love math. I love statistics. I enjoyed all that. I really enjoyed the courses I took in research, but I realized that not every nurse went into nursing thinking that they were going to have to do anything with math or anything with statistics or whatever. I think we often think I remember teaching undergrads and I would ask them a question, how are you unique? To a person, and I taught hundreds and hundreds of these undergrads, to a person they all said, I'm a very caring person, I like to take care of people. So I think in general, nurses think more of themselves as caretakers and less as scientists. But I think the further along you get in your education and the more skilled you become as a nurse, the more you realize that while you are a caretaker, you are a scientist. And unless you put the two of those together, your patient care is not going to be the best that it possibly can be. And your patients are going to suffer if you're not both a caretaker and you use your understanding of the humanities and the arts along with your understanding of science. So, while I personally like it, I realize others don't like these math and science kinds of things, but it is, to me, it's 100% clear that you cannot practice good nursing care if you don't utilize the sciences, and in that I include math and statistics. So, for example, in my own work, I have primarily worked in the area of interpersonal violence. And the reason that I did that was in all those years that I did inpatient psychiatry and mental health, and then outpatient psych mental health in doing psychotherapy, I really became intrigued by the fact that so many of my clients, as I explored more deeply with them their background and what was going on, it was not at all unusual to have them reveal some kind of history of interpersonal violence, often in their family of origin. Not always, but often in their family of origin. And so I began to realize that a lot of psychotherapy is really trauma-focused, and that if you don't, you can have all the talk therapy that you want, but if you don't eventually get to the trauma and how to deal with it, patients don't get better. So with that in mind, as I became a researcher, my research partner and I became interested in these patients who return over and over and over again to their primary care health practitioner with these very vague somatic complaints. You know, I have a headache, I have a stomach ache, I've got blurred vision, I've got tingling in my hands. And of course, then all the, I've got heart palpitations, and so the MRIs and the EKGs and the EEGs and the CAT scans and everything else are all run, and surprise, surprise, nothing shows up on clinical findings. And yet these patients continue to return saying they don't feel well. And so, because we had already done a lot of work with interpersonal violence in our research, we began to wonder, and the literature was supporting that there was probably a connection between childhood or other kinds of interpersonal violence and maltreatment and later physical symptoms. But what we didn't really know, and the literature wasn't clear on, is it was pretty clear that if you'd experienced physical violence or sexual, especially sexual violence, that it was often connected with things like pelvic pain. But what was a little less clear was, what about these lower level kinds of emotional abuse and neglect, and how might that affect people's perceived general health and their physical health and their mental health in adulthood, and especially where the actual trauma symptoms, how did they relate to the physical symptoms? So, for example, nightmares, intrusive thoughts, what did that have to do with the general perceived physical mental health of people who present in primary health care? And we began to think too, what about all the healthcare dollars with these repeated visits? And so what we did, we actually ended up doing a trauma-focused therapy in the waiting room in the evening at a family practice, and then again in an internal medicine practice. We did these group therapies with these women. But in preparation for that, we did a screening in the waiting room. And this is the part of about statistics that I think is really important for nurses to understand. What we were worried about clinically was, what about these people who keep coming back using healthcare dollar after healthcare dollar, many, many tests run, and they're still not feeling better, and people are perplexed. So we just went into a regular waiting room in an internal medicine clinic, and we screened about 160 women, and they ranged in age from 18 to almost 90. So we're talking about women across the lifespan, and we asked them to fill out questionnaires about childhood abuse and neglect, about their current general perceived health, their mental health, their current mental health, their current physical health, and also any trauma symptoms they might be experiencing. So they filled out these questionnaires, and you can have all the questionnaires in the world, but if you don't analyze the data correctly, you won't know what to do in clinical practice. So we, one of the things that I've learned as a researcher is I'm not a statistician. So we hired our wonderful statistician who helped us run the statistics on these different instruments that we had collected. And what we did is essentially we did regression. And so what we did is we developed theoretically a causal model. We said theoretically, as psych nurses, and my research partner is also a psych nurse, we said as psych nurses, theoretically, we think that the neglect, emotional neglect, physical neglect, we're not talking about abuse now, we're talking about neglect, just not getting what you would need physically and emotionally as children, and then actual emotional abuse, but with no physical contact. We thought that those three things, emotional neglect, physical neglect, and emotional abuse, would predict how much physical abuse and sexual abuse occurred in a family. So we figured if you, those kind of lower level non-contact, we call them, kinds of violence would probably be predictive of physical violence and sexual violence, the contact violences. And we thought that all five of those kinds of neglect and abuse would be predictive of trauma symptoms, your intrusive thoughts, your nightmares, your panic attacks, and that the trauma symptoms, that all five types of abuse and the trauma symptoms might together and separately be predictive of how someone's physical health is in adulthood, how their perceived general health is, and how their mental health is. And so we set up a model, and you'll be able to see the model here on the screen, where we predicted theoretically, based on our clinical practice and the literature, that all of these things would predict each other. But here's the idea. Okay, so why do we care? What difference does it make clinically? Well, if you're someone who's seeing a patient in clinical practice who comes in and says, I have headaches, I've got stomach aches, and you run all of these tests and you can't find anything, here's one way you can handle it. You can say, there's nothing wrong with you. Well, I can tell you as a psych nurse exactly what's going to happen when you kind of go down, there's nothing wrong with this patient route. That patient is going to return again and again and again because something is wrong. The problem is you can't find it on your physical findings because it's not physiologically based. It's psychologically based. And so what we were arguing was that if you don't deal with the trauma symptoms and the earlier trauma, you are not going to be able to quote cure, take care of these physical problems that the person's having. So all these EEGs, all these EKGs, all these MRIs, all the CAT scans, all the blood work is not going to do anything if in fact what the patient really is dealing with is trauma symptoms and the sequelae of childhood neglect and abuse.